When was the last time you sat down and shared a meal with someone? Not ate in front of the television, not picked at something standing over the kitchen sink, but actually sat down at a table with another person and shared a meal. If you had to think about that for a moment, you're not alone, and that quietly is part of the problem. In 2023, the United States Surgeon General did something remarkable. He published an 82-page advisory declaring loneliness an epidemic in America. Not just a feeling, not just a side effect of getting older. A documented, measurable public health crisis. One he compared in urgency to tobacco use, obesity, and the addiction crisis. But there is a fix. It doesn't cost a dime, it requires no prescription, and our grandparents did it every single day without even thinking. I'll show you exactly what the peasant's prescription is in just a moment. Let's start with the scale of what we're actually dealing with. When the Surgeon General calls something an epidemic, that's not casual language. That's a declaration that a health problem has grown large enough and serious enough to demand a national response. Lacking social connection, the kind of connection that comes from regularly being around other people, sharing meals, having conversations, feeling like part of something, can increase the risk of premature death as much as smoking 15 cigarettes a day. That's from the Surgeon General's advisory directly, not a fringe study, the official position of the United States government's top medical authority. Among older adults specifically, chronic loneliness and social isolation can increase the risk of developing dementia by approximately 50%. Heart disease risk goes up by 29%. Stroke risk goes up by 32%. Social isolation among older adults accounts for an estimated $6.7 billion in excess Medicare spending every single year, driven by increased hospitalizations and nursing facility use that could have been prevented. And in a 2023 national poll of adults aged 50 to 80, 1 in 3 reported feeling isolated from others. 1 in 3. If you're watching this, and your house feels a little too quiet at dinner time, I want you to hear this loud and clear. This is not your fault. It is not a personal failure. It is a structural epidemic. Many of the people watching this video right now have felt something shifting over the past few years. Fewer meals shared. Quieter tables. That has a name and it has solutions, and that's exactly what we're here to talk about. Now let's get specific about what eating alone is actually doing inside the body after 60, because this is where the research gets both surprising and urgent. In late 2025, researchers at Flinders University in Australia published findings drawing on data from over 80,000 older adults. One of the most comprehensive looks at the relationship between eating alone and physical health in seniors ever conducted. What they found should be part of every conversation about senior nutrition. A person eating alone doesn't just eat differently, they stop feeling hungry. The motivation to cook something real, something varied, something nourishing, quietly fades when there's no one to cook it for, or with. A peer-reviewed study on homebound older adults found that those who had other people present during meals consumed an average of 114 more calories per meal than those who ate alone. Not because someone forced them to eat more, because the presence of another person naturally changed how they ate. This is not a small effect. Eating with other people changes what seniors eat, how much they eat, and how their bodies respond to what's on the plate. As we age, hunger cues naturally weaken, taste and smell shift. Social eating fills that gap. The conversation keeps you at the table longer. The food looks more appealing when it's shared. When those social cues disappear, the body loses something it was quietly depending on. Not just company, a nutritional anchor. The peasant's prescription was never just about what was on the plate. It was about who was sitting around it. You might be wondering, if it's so simple, why aren't we doing it? The truth is, the modern world was quietly redesigned to isolate you. It didn't happen all at once. Modern housing moved away from communal spaces. Families scattered geographically for work. Widowhood quietly removed the person who had been across the table for decades. And the modern food environment, the microwave meal, the single-serving package, made solo eating easier and more normalized than it has ever been in human history. The world changed around an entire generation. The shared meal got harder to maintain and easier to let go of. But naming it clearly is the first step to changing it. So we are going to change it, not next month, this week. Here is your 6-step action plan to bring the shared table back into your life starting tomorrow. Step 1. Identify one meal this week that you can share with another person. A neighbor, a family member, a friend. It doesn't have to be elaborate, it just has to be shared. Start with one. Step 2. Look up your local senior center or congregate meal program. The Eldercare locator at Eldercare, ACL, Gov lets you search by zip code. Most of these are free or donation-based. This takes 5 minutes and the results may surprise you. Step 3. If leaving home is difficult, ask your doctor or your local area agency on aging about home-delivered meal programs like Meals on Wheels. Medicare data shows that 180 days after starting these programs, hospitalization rates drop by 31%. The volunteer at the door is a human connection. Exactly what the research says the aging body needs. Step 4. If you live alone, try eating at least one meal a day with some form of human presence. A phone call with someone you trust. A video call with a grandchild. Research suggests that social cues help even at a distance. Step 5. Pay attention to your appetite. If you've been eating less without trying or losing weight without meaning to, mention it to your doctor. These are patterns worth addressing early. Step 6. Share this video with someone you know who lives alone, not as a lecture, as a gesture. Sending it is itself a form of connection, and it might just start a conversation that leads to a shared meal. Your grandparents didn't think of dinner as a health intervention. They just sat down together, every day. That ordinary rhythm, the shared table, the familiar faces, the simple food eaten in company, turned out to be one of the most quietly powerful things they did for their bodies, their minds, and their lives. Modern science didn't discover anything new. It just finally measured what worked. If these conversations matter to you, if you want to keep learning what simple, traditional wisdom and modern research have to say about staying strong, healthy, and independent after 60, we'd be grateful if you'd subscribe to this channel. We'd love to have you here for the next one. And before you go, tell us in the comments, who do you most remember sharing meals with growing up? Drop their name. It might just remind someone else of something important.